So today I am going to demonstrate on how to turn and position a patient in bed. So turning is or positioning a patient in bed is very important, especially if they are laying in the same position for a very long period. This is so because they have high risk of developing decubitus ulcers, or which we call the pressure wounds. Okay, so first thing we're going to do is to assess the patient and introduce yourself, inform the patient what you're going to do. So, good morning, ma'am. My name is Chrisline, and I'm your caregiver for today. And what we're going to do is I'm going to help you turn or position you in bed. Is that okay, ma'am? Yes. Okay, thank you. And also, one very important thing as well, as we always do with the patients, is to make sure that we have the right patient by checking their wrist tag for their name and their birthday. So, to confirm, ma'am, may I have your name and birthday, please? Alright, thank you, ma'am. So now we have the right patient. And prior to this procedure, I have already properly washed my hands. Okay, so to begin with the process, first what we're going to need to do is, if we are in a hospital setup, we need to lower down the rails, the guard rails. So example of this is your side, so you have to lower it down, and that other side you have to remain it as is, because if you're turning the patient on the left side, we don't want the patient to fall if ever that something goes wrong with you turning or helping the patient to turn. Okay, so we lower the guardrails on your side, and then we proceed in turning the patient. Okay, so we want to make sure that the patient is on the center of the bed, and that the patient is also on top of a linen. So for this procedure, this linen is going to be our friend, because this is going to help us in turning the patient. So technically, what we're going to use for this one is we need to have a strong shoulders and hips as well, because those are parts of our body which is going to help in doing this procedure. Okay, so now that we have the patient in the center of the bed, and we have already made sure that we have a linen, okay, where she is lying down right now. Okay, so technically the reason why we're helping our patient here is because she cannot literally move herself or move position by herself. So we are helping her out. So first, to begin with, let the patient know what you're trying to do, okay? So, ma'am, I'm going to move you or help you move onto your left side, okay? So put the hands on her chest, okay? And then with the use of a pillow, okay, we would move or do it this way on the back, okay, and then put your hands on the back and then position the patient onto her left side. Okay, now I'm just gonna move you, and then put the pillow here as a support. So we want to make sure that the patient is comfortable as you move her around. Now what we're going to need is another pillow here to tuck in between her legs. So this is all we're going to do. So just move it like that, and then tuck the pillow in there. Okay, so now that the patient is almost in the position, okay, so now that the patient is almost on her side now, what we're going to need to do is to pull the linen so that we can move the patient onto the center of the bed. So, ma'am, I'm just gonna pull the linen, okay, to help you move. So on the count of 3, 1, 2, 3. Okay, there you go. Okay, so now that she's already in the center of the bed, I'm now comfortable. I'm now kind of sure that she's in a comfortable position. I can now remove the pillow on her back as a support. Okay, so remove the pillow, okay, and then her head is a bit down, so I'm just going to help her with the pillow. So ma'am, I'm just going to raise your head a bit. Okay, there you go. Alright, ask the patient if she needs something else, or okay, so now that we have fully turned the patient and she is already in a comfortable position, we can now raise the guardrails again, okay, if we are in a hospital setting. And then, so that's it. That is how you turn the patient in bed. Thank you.